Describe the role of the nurse in the healthcare market. We're going to discuss first the history where the role of the nurses came from some ideas to different personality. We have here Florence Nightingale, environmental theory. Environmental theory, Florence Nightingale, mid-19th century. History. Florence Nightingale, a pioneer of modern nursing, developed this theory based on her experiences during the Crimean War. She observed that unsanitary conditions in hospitals were contributing in high mortality rates. Her work focused on improving hygiene, ventilation, and overall environmental factors to promote patient healing. Theory. Nurses create clean and safe environments to help patients heal faster. Example, a nurse makes sure a patient's room is clean, well lit, and quiet to promote rest and recovery. She also ensures proper ventilation and temperature control to create a comfortable environment. We have Dorothea Orem, self-care deficit theory. History. Dorothea Orem, a nursing theorist, developed this theory during the post-World War II era, when healthcare was shifting towards a more patient-centered approach. Theory. Nurses teach patients how to take care of themselves so they can get better and then stay healthy. Example, a nurse shows a patient with diabetes how to check their blood sugar levels, administer insulin, and follow a healthy diet. This empowers the patient to manage their condition at home. We have Hildegard Peplau, interpersonal relationship theory. History. Hildegard Peplau, a psychiatric nurse, developed this theory during a time when mental health care was evolving. Peplau emphasized the importance of the therapeutic relationship in promoting healing. Theory. Nurses build a strong relationship with patients by listening, communicating clearly, and offering support. Example, a nurse is spend time talking to a patient who is anxious about surgery, listen to their concern and helps them understand the procedure. This builds trust and reduce anxiety. Ida Jean Orlando, nursing process. Nursing process theory. Ida Jean Orlando, 1950s. History. Ida Jean Orlando, a nursing theorist, developed this theory during a time when nursing practice was becoming more standardized and evidence-based. Theory. Nurses follow a step-by-step process to provide the best care. Assess. Gather information about the patient's health. Diagnose. Identify the patient's problem. Plan. Create a care plan to address the problems. Implement. Carry out the care plan. Evaluate. Check if the care plan is working and make changes if needed. Example, a nurse assesses a patient's pain level, diagnose the cause as muscle strain, plan a regimen of pain, medication, and exercises, implements the plan, and then evaluate the effectiveness of the intervention. Jean Watson, Theory of Human Caring. Theory of Human Caring, Jean Watson, 1970s. History. Jean Watson, a nursing theorist, developed this theory during a period of growing interest in holistic healthcare and patient-centered care. Theory. Nurses care for patients' bodies, minds, and spirit to promote overall well-being. Example. A nurse listens to a patient's worries about being away from their family, offers comforting words, and helps them connect with loved ones through video calls. This addresses the patient's emotional needs. Madeline Leininger, Transcultural Nursing. Transcultural Nursing Theory, Madeline Leininger, 1960s. History, Madeline Leininger, a nursing anthropologist, developed this theory during a time when healthcare was becoming more globalized and diverse. Leininger recognized the importance of culturally sensitive care theory. Nurses understand and respect different cultures to provide sensitive and appropriate care. Example, a nurse learns that a Muslim patient prefers to have a same-sex nurse provide care. She respects these preferences and ensures the patient comfort and privacy. Role theory. History. Role theory is a broader sociological theory that examines how individuals behave in social situations and how these behaviors are perceived by others. It is applied to nursing to understand how nurses navigate their roles within the healthcare system. Theory. Nurses understand their roles within healthcare team and how to work effectively, and doctors, other nurses, and support staff. Example, a nurse communicates clearly with a doctor about a patient's declining condition, ensuring everyone is on the same page and working together to provide the best care. Nurses are essential to healthcare market, playing many roles to keep people healthy. Here's simple breakdown of their key responsibility. Caring for patients. For us to be able to care to be patient, we are a caregiver. Nurses provide direct care, helping patients get better by giving medications, checking on them, and making them comfortable. Communicator. Nurses talk with patients and their families, explaining things clearly and listen to their concern. Teacher. Nurses teach patients about their health, how to take care of themselves, and how to prevent illness. Counselor. Nurses offer emotional support and guidance to help patients cope with their health changes. Client advocate. Nurses stand up for patients, making sure they get the best possible care and that their needs are met. Leading and managing. Leader. Nurse often guide teams of healthcare providers, making sure everyone works properly together smoothly. Manager. Nurses organize care, plan schedules, and make sure resources are available for patients. Coordinator. Nurses connect with other healthcare professionals, like doctors, to make sure patients receive the right care. Critical thinker. Nurses use their knowledge and experience to solve problems and make smart decisions about patient care. Team player. Nurses work well with others, sharing information, and working together to provide the best care. Improving healthcare. Motivator. Nurses encourage patients to stay positive and participate in their recovery. Researcher. Nurses help find new ways to improve care by studying how treatments works and what helps patients get better. Delegator. Nurses assign tasks to other healthcare providers to make sure everything gets more efficiently. Innovator. Nurses are always looking for new ways to improve care and make things easier to their patients. Decision maker. Nurses use their knowledge and skills to make important decisions about patient care, ensuring safety and well being. The nursing process. Assessment. Nurses carefully gather information about their patients to understand their health needs. Diagnosis. Nurses identify their problems that need to be addressed. Planning. Nurses create a plan of care to help patients get better. Implementation. Nurses carry out the plan of care, providing treatments and support. Evaluation. Nurses check to use if the plan of care is working and make changes as needed. Nurses are skilled professionals who combine passion, knowledge, and treatment to provide excellent care and improve the health of communities. Nurses are skilled